Assalamu alaikum. It is really my honor and privilege to be here today with you. In the coming 15 minutes, I'm going to share with you, as Dr. Amin shared with you, that tildrakizumab in one of the immune-mediated conditions to us. I'm going to share with you another molecule, which is the ritlecitinib, in cases of another immune-mediated condition, which is alopecia. These are my disclaimers. And alopecia areata pathogenesis is really a complicated one. I'm just going to talk in 2 or 3 slides, very brief, because my main focus is about the results of the ritlecitinib in the treatment of cases of severe, moderate to severe alopecia areata. As we know, all of us, that alopecia is a hair follicle cycle disorder. We know that the hair cycle from anagen to catagen to telogen, and it has been defined since very long time. What happens during in the presence of alopecia, that this hair follicle cycle has been disordered, and only hairs which are in the anagen phase who are being affected, and it has been characterized by premature induction of anagen to catagen. Usually the hairs remains in the anagen for about 9 to 12 months, and then in the catagen for about few weeks. In alopecia areata, the hairs, there is a premature induction of hairs in the anagen phase to go to the catagen phase and leave the area of the skin bare without any hair. And as you know, our hairs are privileged by protection from other immune mediators around the hair follicles, which we call it immune privilege of the cells, immune privilege of the hair follicles. And that's why when there is, this all happen due to loss of this immune privilege. Again, the interferon plays a very important role in the induction of alopecia, and it has a loop, which is a continuous loop. Very briefly here, we can see that the interferon gamma can attach to two receptors, receptor 1 and receptor 2 on the surface of the follicular epithelium, and through the JAK-STAT pathway, they send signals to the nucleus of the follicular epithelial cells, which leading to the production of many inflammatory cytokines. Again, this is not only the way, and then these cytokines can produce more and more interferon gamma, sorry. So interferon is producing more and more interferon. That's why it is a continuous loop. Blocking of this interferon, or blocking of the JAK1, 2, and 3, and the TEC, which are the 4 JAK classes, can lead to the improvement or the restoration of the immune privilege of the hair follicles. And this can be achieved by many of the, some of the JAK inhibitors like tofacitinib, ruxolitinib, as well as the newly introduced ritlecitinib, which is really more targeted. Ritlecitinib, which is the most recent approved molecule for the treatment of alopecia areata, it has a selective dual inhibition targeting both JAK3 and TEC, which are 2 of the kinase families. By inhibiting this or by blocking the action of JAK3 and TEC, it does reduce the inflammation at the hair follicle, and that's why it restores back again the immune privilege. And on the right-hand side, we can see that by inhibition of the JAK-STAT inhibitory process, there will be, by inhibiting both kinase inhibitors, kinase family, JAK3 and TEC, kinase family, it does lead to reduction of the release of some inflammatory cytokines, many of them, like interleukin 4, 7, 2, 15, and 21, and even it does reduce the cytolytic activity of the immune cells. So blocking of JAK3 and TEC lead to blocking all the pathophysiological causes of alopecia areata. Of course, I'm not going to spend a long time about how we are assessing the alopecia, because I think all of us knows that we are dividing the scalp into four parts: right, left, top, and back, and each one representing, each one of the sides, it represents 18% of the area of the scalp, while the top one is 24% and the back one is 40%, the top, and 24% the the back side. There is just one example on the right-hand side. This patient has SALT of 70 because he has 95% loss of the hairs on the left temple and 95% loss of the right temple, 50% loss of the top, and 60% of top of the back. When we are going to calculate and add of them, it will equal, we can see this in the lower line, 69.8, which means SALT 70. It means that this patient has lost 70% of his hairs. So when we say SALT 100, it means that the patient has no hair. And we say SALT 0, it means the patient has complete regrowth of hairs. Okay. Again, alopecia areata, when we are going to calculate the SALT index, we have to stratify the patients. And this stratification has been done by, approved by many experts in the field of alopecia and dermatology, and they consider that patients with 20% or less loss of hair, scalp hair, it means it is mild form. Between 20 and 50, it means that the patient has moderate alopecia, and between 50 and 100 means severe. This JAK inhibitors have been approved to treat moderate to severe alopecia areata. Of course, there are other factors which can decide the severity of the condition, like negative impact on the psychological functioning of the patient, noticeable involvement of the eyebrows and eyelashes, or if there is diffuse multiple patches, or positive hair pull test, or inadequate response for more than 6 months for treatment. All these factors, if the patient has any one of these factors, will make 1 point more. So if the patient has mild alopecia with noticeable involvement of the eyebrows and eyelashes, it becomes moderate. And if he has a moderate and negative impact on the psychological, he will be severe. I'm going to share with you the reticetinib data. This study, there are 2 studies, but just I'm going to brief you that in these studies, almost 46% of the patients have alopecia totalis or universalis. Females, the absolute SALT index at the beginning was between 82 and 90%, and 14% of the patients were adolescents between 12 and 18 years of age, and 55% of them were females. And we can see that almost between 73 and 82% of the patients have either eyelash involvement or eyebrows involvement. And these are the results after 24 weeks, which was the primary endpoint after 24 weeks. And you can see on the right-hand side the SALT of how much of those patients have multiple hair regrowth, that their SALT index is 20 or less. We can see after 24 weeks, it is 23% of the patients were able to achieve this goal. And with the continuation of the treatment till the end of the first year, almost 43% of the patients have SALT 20 or less. If we go to the left-hand side, this is the SALT 10 or less. Of course, the numbers will be much less. So after 1 year, even primary results at the week 24, 14%, and at the end of the first year, 31% of the patients were able to have SALT index of 10 or less. Again, this has been reflected on the improvement of the hair regrowth on the eyebrows and eyelashes. And you can see for the eyebrows at the end of the first year, almost 44% of the patients have achieved the moderate to normal eyebrows. And again, for the eyelashes, almost 40% at the end of the first year can have marked improvement or moderate to normal eyelashes. What I mean, it is the treatment with the JAK inhibitors for alopecia is a long treatment. Don't expect early treatment. And usually, I'm telling my patient, don't expect noticeable changes before 9 months. Again, this is a long-term reticetinib, as I mentioned before, after not only 1 year, after 2 years, after 24 months. And we can see, again, the SALT list, SALT 10 or less. We can see that almost half of the patients were able to achieve this, which is very noticeable, and it can be considered as a normal person. And SALT index 20 and more, we can find that 60% or 61% of the patients were able to achieve SALT 20 or less. So about this study, which is a post hoc analysis of patients who achieved hair growth response at week 24 and has been sustained up to 48. We can find this were almost 130 patients. Those 29% were responders, 90 were non-responders, and 11 were missing. About those responders, when they continue after 24 weeks up to the end of the first year, we can see that SALT of 10 or less can be achieved in 87% of the patients. Again, the eyebrows and eyelashes, we can see that 70 to 78% of the patients were able to achieve marked response for the eyelashes. The non-responders, the 90 persons who did not respond at week 24, non-responder, it means that they didn't achieve SALT index of 20 or less. If they follow the treatment up to the end of the first year, we can see that they can achieve SALT 20 and less in about 33% of the patient, with marked improvement as well for the eyebrows and eyelashes. So continue with the treatment will be very effective. I like this diagram a lot. These are the many trajectories. If you can see to the gray line, green line, those patients who are achieved SALT score less than 20 from the beginning at week 6, and they continue to achieving this up to the end of the 2 years. While the blue one, they are the middle responders. Those can achieve SALT, did not achieve SALT at SALT 20 at week 24, but with the continuation of the treatment, they were able to achieve SALT 20 at the end of the second year. The late responders, those patients which are represented by the pale purple one, they were not able to achieve SALT 20 till the end of the first year, but after that, they were able at the end of the second year to achieve the same SALT index of 20 or less. Partial responders, which are represented by the deep purple one, they were not able to achieve SALT 20 at end of any of these stages, but there was marked 30% reduction of their initial SALT index at the end of the second year. Relapses, those patients who were not able to be represented by the orange one, they were not able to achieve SALT index of 20 at any stage, and even after the end of the first year, they have more relapse. The black one, those patients who were failures, they did not respond at all through the 2 years of treatment. This is some of the slides of these pivotal studies, according to which the treatment has been approved in many areas of the world. Yes, 2 minutes. I'll finish on time exactly. This is one of the cases representing at the baseline the SALT of 74, and after 6 months, 0. Complete hair regrowth. Again, this is another patient. Some of them are late responders like this one. At the beginning, the SALT was 68. After 6 months, it was 20. But at the end of the 2 years, it became 12. This, again, is more showing for the late responders. Even after 12 weeks, still the SALT is 100. But at the end of the 6 months, the SALT becomes 13.4. I'm going to share, again, what the characteristics of early responders. They are usually mainly females. They have a lower mean baseline SALT score with a lower proportion of patients with alopecia totalis or universalis, and a lower proportion of patients with affection of the eyebrows or eyelashes. Again, that the duration of the disease, if they are much than 1 year, they have much better prognosis than patients which have the disease for more than 1 year. So 3 years increase in the duration of significant scalp hair loss lead to a reduction of the likelihood of response. Again, the SALT index, 15 units increase in the baseline, and 15 is different than 65, leads to a reduction of the likelihood of response by almost 63%. So the early treatment and with the small area of involvement gives it much better results. Again, this is to show the safety profile. There is no changes, there is no any alarming signs. Even those of special importance, like the MACE and the VTE and the ATE, they are not increasing, even the much lower than patients do not receive rituximab. So rituximab is a SALT and clinical reported outcomes is very important. It has better response predictors, and it is really safe drug. Just I'm going to share with you one of my cases in 1 minute. This is a gentleman who was about 43 years old, and he has this alopecia since 2 years. Of course, he has a little bit of male pattern baldness, and you can see that after just after 6 months, 24 weeks, his SALT index has been changed from 73 up to 5. Of course, there is a little area of male pattern alopecia which will remain there. It has nothing to do with the reticulocytic. This is the top of his head. This is the right side. This is the left side. And this is the back side. Just in 24 weeks. Thank you.